advanced capacity, autonomous learning, clinical judgement. So I coordinate the Master of Nursing Nurse Practitioner program here at Sydney Nursing School. Nurse practitioners are advanced practice nurses who have already specialised in different areas, for example emergency or intensive care, wound care, and so many different specialities, who when they become endorsed as a nurse practitioner, they have an expanded scope of practice and additional extended privileges by legislation, for instance prescribing medicines, referring patients to other healthcare professionals, or referring for additional diagnostic assessments. Our course here at Sydney Nursing School has been running 3 years, and currently we have just over 60 students enrolled in the program. When we look at nurse practitioners across the country and we look at the context of where they're working and the specialities, our student cohort resemble that. So our program builds on speciality knowledge. So students who come into our program have already completed postgraduate studies in relation to their speciality. And so the main emphasis of our program is building on that speciality knowledge in developing the extended skills, expanded and extended skills. Our program is quite heavily orientated towards advanced assessment, pathophysiology, use of laboratory and radiology, diagnostic investigations, pharmacology, prescribing, and in the latter half of the program then uses that knowledge and skills to move forward in developing a professional portfolio, which then students have then become eligible to apply for endorsement as a nurse practitioner. There is a mandatory clinical component to the program where the students have a clinical supervisor in the clinical area, either a nurse practitioner or often a medical specialist related to their area, to help them to develop those extended and expanded skills. One of the ways that we manage that interface between the clinical and the academic is by having nurse practitioners on our teaching staff who liaise with the students and the clinical supervisors in the clinical area. And that's certainly a strong feature of our program, that integration of clinical and academic. Graduates from the Master of Nursing Nurse Practitioner will have developed advanced and extended skills in their practice, in their clinical practice. While conducting the course, they will have worked closely with a primary clinical supervisor in the clinical area, helping them to integrate their clinical practice with their academic studies. They will be good users of evidence to support their practice, a very important feature of nurse practitioner courses. And they will have developed capability to identify relevant questions in their practice and also have the skills to answer those questions, utilising the best evidence that's available to them. One of the great things about studying at Sydney Nursing School is that here in the university we are a faculty within a discipline of health. And therefore we interact quite closely with the Faculty of Medicine, Faculty of Pharmacy, diagnostic radiology faculties. And so one of the great advantages of studying here is having exposure to our colleagues from other faculties who bring their expertise to help students develop their future capability. And this is quite reflective of how nurse practitioners work in the clinical area, in working with pharmacists and working with radiologists and radiographers as well as our medical colleagues. One of the things I really enjoy about teaching is the ability to integrate it with research, not just my own personal research, but to actually integrate evidence into practice. And that's a very strong feature of our courses, the utilisation of best practice or best available evidence to support nurse practitioner practice. And so in teaching, one of the joys of teaching, of course, is seeing students develop and seeing students progress. And particularly in a nurse practitioner course where you tend to be working with very highly motivated and highly specialised registered nurses before they come on the course. And so it's a real joy to see them become endorsed. I think the future for nurse practitioners is very bright. There is a lot of scope for nurse practitioners in the current health system. The demand on health services is quite high. Most people are aware that the demographic of Australians is ageing. Most people are aware that chronic disease is on an increase. And likewise, acute presentations to hospitals is increasing as the demographic of patients in hospitals. And so there is a lot of scope for nurse practitioners. Currently we We estimate there are over 900 nurse practitioners in Australia, and we anticipate that will expand dramatically over the next immediate years as service needs require more skilled advanced practice nurses.